who's one of Haran's Medicare experts. Today we're going to be spending the next hour and a half or so talking about Social Security and Medicare. So everything you need to know from start to finish when it comes to these two topics. So for the first 45 minutes, I'm going to discuss Social Security planning. And then the second 45 minutes, Nate will talk about Medicare and everything you need to know there. So once again, my name is Michael Hermes. I'm a financial advisor at Haran. I'm a certified financial planner, chartered financial analyst, and national Social Security advisor. At Haran, we do investment management and financial planning, as well as offer health insurance benefits as well. And so throughout this next 45 minutes, if you have any questions at all about the presentation or Haran in general, feel free to type them in the question and answer chat. We'll be happy to answer those for you. Before I start off the presentation, one thing I always like to say is if you're ever working with a financial advisor, you want to make sure that you're working with a fiduciary. So hopefully everyone on this call today has heard that term before. Essentially what a fiduciary is whoever is giving advice has to make sure that they have your best interests in mind. So they can't just sit there and sell you a product. They need to make sure any recommendations that they give you are in your best interest. So if you are working with a financial advisor or planning on working one, always ask if you're working with a fiduciary, okay? An easy way of knowing if you're working with one is if they have the letters CFP after their name. It stands for Certified Financial Planner. And so at Haran, all of our advisors are fiduciaries. So with that being said, we got about 9 different subjects that we want to get through when it comes to Social Security planning. First of which is, will Social Security be there for you? You hear a lot about how the system's going broke, right? So we'll kind of debunk that myth just a little bit. How much you can expect to receive your benefits and how they're actually calculated, when you should apply for your benefits and different strategies you can utilize to maximize those benefits. If you have a non-covered pension, and being in Ohio, the 2 most common ones are STRS and OPERS, how that could negatively impact your Social Security benefit, how they're taxed, how you actually apply for Social Security. Something new in the system that was released in the past couple of years is how to designate a representative payee, so someone who can make decisions for you on your behalf should you become mentally incompetent to do so yourself. And lastly, how it all fits into your Social Security retirement picture. All right, so will Social Security be there for you? You hear a lot about how the system's going broke, right? And so that's kind of half truth. And so every single year, the Social Security Administration releases their annual results. So this is the end of 2019. We're still waiting on 2020 results to come out. So every single year, about $1.062 trillion comes into the system via taxes on your paycheck. And then every single year, about another $1.06 trillion leaves the system in the form of benefit payments. So there was actually a surplus at the end of 2019 of about $2.5 billion. And that surplus goes into the Social Security Trust Fund. And that trust fund sits there earning interest, ready to be paid out to beneficiaries in case there's no more surplus, okay? So this year, or actually I guess now, technically last year, 2020, it was projected that that was going to be the first year where there's no more surplus. So more money is being spent than coming into the system. And so going forward, every single year, they're going to have to start dipping into that trust fund to continue paying beneficiaries 100% of their benefit payment. So without any sort of reform, it's expected that by the year 2035, everyone will receive 79% of their benefit payment. So year 2035, that's when that trust fund is depleted to zero. So the Social Security Administration can only pay out as much as they take in every year. So everyone will get roughly 79% of their benefit payment in the year 2035. Now, there are some ways that they can fill in that gap to ensure that everyone does get 100% of their benefit payment throughout their lifetime. A couple things. There's currently a bill in Congress called the Social Security 2100 Act. If this gets passed, everyone will get 100% of their benefit payment through the year 2100. And so there are a couple primary ways that they're planning on fixing the system. The first is to increase the overall tax rate. So currently, both you and your employer pay 6.2% Social Security tax. So what they're going to do, Congress is going to raise this gradually by another percent over the next 25 years for both you and your employer, so 2% total, up to 7.2% tax rate. The second thing is that they're going to increase the amount of Social Security that is subject to tax. So the amount of income that you pay Social Security tax on. So currently, the first $142,800 of your income is subject to Social Security tax. If you make more than that, that tax stops. But what they're planning on doing is if you make over $400,000 per year, that tax will kick back in. So there's going to be some sort of earnings donut hole, if you will. So those are the two primary ways that they're planning on fixing the system: increase the overall tax rate and increase the amount that's subject to tax. And voila, you've managed to fix the system. However, there are a lot more nuances than that, so I wouldn't be surprised if they add in a few different ways of fixing the system as well. But with the way it stands currently, come year 2035, everyone will get roughly 79% of their benefit payment. Now, hopefully, if you're on this call today, you've taken a look at your Social Security statement before. And if you haven't, that's okay. When you get your statement, this is what it will look like on the front-hand page. And so in the top right-hand corner, there's a big bold number, and that number is the amount that you are expected to receive at your full retirement age, which we'll get into in a second. But how are they coming up with your Social Security benefit? The national average benefit is around $1,500 per month or so. And what the Social Security Administration is doing is they are using the highest 35 years of your earnings history, plugging it into a formula that's too complicated to go over today, and outspits your benefit amount, okay? But the key here to remember is they're using the highest 35 years of your earnings history. So when you get your Social Security statement and you open it up and you turn it to page 3, it will look something like this. I know it's a little small to see, but it will list every single year that you contributed to Social Security and Medicare. So go through your earnings record and make sure it looks accurate. Make sure you don't have any zeros in there for years you in fact did contribute to Social Security. If you do have a zero in there, it could negatively impact your benefit amount. Okay, but once again, they're using the highest 35 years of your earnings history. And so if you're going through your statement and you're counting up the years and you realize that you have 34 years contributing and you're contemplating working one more year to get that 35th year for Social Security reasons, I promise you it is not worth it. So the amount that you'll pay in tax versus what you'll actually get back in benefit, you have to live to be age roughly 160 or so to break even on that money, okay? So don't delay retirement necessarily just for to get an extra year of Social Security earnings under your record. But once again, they're using the highest 35 years of your earnings history. So go through and get your statement, turn it to page 3, and double check to make sure it looks accurate, okay? If you've never gotten your Social Security statement before, I would encourage everyone after this call today to log on to ssa.gov and pull your Social Security statement. You create an account and you can pull your Social Security statement at any time and see what your benefit looks like, as well as be able to double check your earnings history. So as I alluded to before, when you get your statement, in the top right-hand corner, there's a big bold number, and that number is the amount that you are eligible to receive at your full retirement age. And so your full retirement age is when you can collect 100% of your retirement benefit. And so everyone's full retirement age is different. Your full retirement age is based upon the year you were born. So if you were born between 1943 and 1954, your full retirement age is 66. And if you were born after 1954, they start to stagger it every 2 months. So that if you were born 1960 and later, your full retirement age is 67. So going back to the Social Security 2100 Act, I wouldn't be surprised if they start to extend this full retirement age date later and later. So fun fact, when Social Security was first started, the full retirement age was 65, but most people only live to be 65 years old. Nowadays, the latest full retirement age is 67, but most people live to be in their early 80s. So the system's paying out benefits a lot longer than it was originally intended to. All right, so a lot of people know this, but you don't actually have to wait until your full retirement age to begin collecting your benefit amount. You can actually start up your Social Security as early as age 62. But for each year you take your benefit early, it's going to be discounted by roughly 7% per year. So if you start your benefit at age 62 and your full retirement age is 66, you will get roughly 75% of your benefit amount. And once you've taken it, you've taken it. That's the amount you're going to receive the rest of your life, okay? On the opposite end, each year you delay taking your Social Security past your full retirement age, so not continuing to work, just delaying taking your benefit will grow a guaranteed 8% per year until age 70. So on that right chart there, if you look in the middle column, if your full retirement age is 66 and you wait until 70 to begin collecting your benefit, you will receive 132% of your benefit amount. And so we actually thought most people knew this. We got a call one time from a physician. He was 72 years old, and he said, "Mike, when should I start taking my Social Security benefit?" And he said, and I told him, I said, well, you should have started it 2 years ago when you turned age 70, because there's no more delayed retirement credits past age 70. So it's not going to continue to increase anymore by 8%. And so he called up Social Security, and the most that they would lump sum him back was 6 months worth of missed payments. And so because he waited to file too long, he missed out on 1.5 years worth of Social Security benefits. So the point to that is never wait past age 70 to begin collecting your benefit amount. So when you get your Social Security statement and you open it up to page 2, at the top there's a section about retirement, and it will tell you what your expected benefit amount is at age 62, your full retirement age, and age 70, so that you can compare the different options. So when should you start collecting your Social Security, right? That's kind of the million-dollar question at play. So 62, your full retirement age 70, or sometime in between. Well, there's a lot of different factors to consider, and if you ask 100 different advisors, you'll probably get 100 different answers, okay? But just because your friends and family say you should do one thing does not mean that that is best for your personal situation. Social Security is really individualized. And so here are a couple things to consider. First is your health status. So if you're not in very good health and you don't think you're going to live a long time, it might be beneficial to start up your Social Security early and collect as much benefits as you can while you're still living. On the opposite end, life expectancy. So if you do think you're going to live a long time and your family has a good history of longevity, it might make sense for you to wait until age 70 to begin collecting. So for example, if you collect at 70 versus collecting at full retirement age, we'll say age 66, you're missing 4 years worth of checks by delaying, right? And so the break even on that is roughly age 82. So if you think you're going to live longer than age 82, it would make sense for you to wait until age 70 to begin collecting. If you don't think you're going to live longer than age 82, you'll probably want to start up your benefits sooner. Number 3 there is need for income. So if you're getting ready to retire and you don't have any other sources of income and you need money to live off of, you'll probably have to go ahead and start your Social Security. Number 4 is survivor needs. So if you have a spouse who maybe doesn't have a high Social Security benefit, you may want to consider delaying your retirement benefit so that they can receive a higher survivor benefit. Whether or not you plan to work. So this is number 5. We see this, this is a big one, and we see people mess this up all the time. Okay, with Social Security, there's something called the annual earnings test. What this talks about is if you begin collecting Social Security before your full retirement age and you are still working, okay, so 62, 63, 64, 65, you cannot make more than $18,960 per year, or Social Security will withhold a portion of your benefit amount from you. All right. So once again, if you are going to collect Social Security before your full retirement age and you are still working, you cannot make more than $18,960 per year, where Social Security is going to withhold a portion of your check. So typically what we see happen is you're 63 and you retire and you start up your Social Security benefit. And so because you started it at 63, it's reduced, so you're not getting the full benefit amount. And then 6 months goes by in retirement, and now you're bored, right? There's only so much golf you can play. And so you end up getting a part-time consulting job and end up making more than $18,960 per year. And then all of a sudden, Social Security sends you a nasty letter in the mail saying they overpaid you benefits and they're going to have to withhold your next few checks from you in order to make up from that. Okay? But the point here is that if you are collecting Social Security before your full retirement age and you are still working, you cannot make more than $18,960 per year, or Social Security will withhold a portion of your benefit amount. Things change, though, January 1 of the year you reach your full retirement age. So for me, January 1 of the year I turned 67, I can now make up to $50,520 per year, or $4,210 per month, before I'm subject to this earnings test. And then the month I reach my full retirement age, so November 1 of the year I turned 67, there's no more earnings test. I can make $1 million per year at my job and collect my full Social Security benefit. I don't have to worry about them withholding anything, okay? So if you take away nothing else from this slide, just know that at your full retirement age, there's no more earnings test. You can work your full-time job and collect your full Social Security benefit with no repercussion, okay? And so that's why we encourage most people to wait until at least their full retirement age to begin collecting, so that they're not subject to this earnings test. Note that this earnings test only includes wages and self-employment income. So if you're taking money out of your investment accounts or IRAs, 401ks, or you're receiving a pension or you have rental property income, that does not count towards these earning threshold numbers. If you are subject to the earnings test and they do end up withholding something from your check, you do not lose the money forever. You'll get it back. What they do is they prorate a portion back into your Social Security payment starting at your full retirement age. So once again, full retirement age, no more earnings test. And we will be sending out a copy of the presentation afterwards to everyone who's listening today. And so there will be an example in there about the earnings test, which should clarify any confusion that you may have. All right, so this is the part of the presentation when I typically get to it. Most people say, no wonder the Social Security system's going broke, because there's ways that you can collect benefits from the system, even if you never contributed. And so we're going to talk about some of the different strategies now that you can utilize to maximize your benefits. The first one we're going to talk about is the spousal benefit. So what the spousal benefit says is you can receive the greater of your benefit or 50% of your spouse's benefits. You don't get both. So once again, you can collect the greater of your retirement benefit or 50% of your spouse's retirement benefit. So here we have Jane and Mike. Jane's PIA is $2,000 per month. PIA stands for Primary Insurance Amount. It is Social Security's fancy way of saying the amount that you are eligible to receive at your full retirement age. So Jane's eligible for $2,000 per month off of her record. Mike's eligible for $800 per month off of his record. Instead of Mike taking his Social Security retirement benefit of $800 per month, he's instead going to apply for his spousal benefit and collect half of Jane's $2,000 and receive $1,000 a month instead of $800. A couple things about this strategy. This does not negatively impact Jane's benefit in any way. She will still receive her full $2,000 a month. The only difference is Mike's now getting $1,000 instead of $800. Another thing with Social Security is that Jane has to be collecting her retirement benefit in order for Mike to take the spousal benefit. So there used to be something called file and suspend. You can no longer do that anymore. But Jane has to be collecting her retirement benefit in order for Mike to take his spousal benefit. Mike's benefit could be zero. His personal retirement benefit could be zero. He could be a stay-at-home parent his entire career. Okay? he can still collect 50% of Jane's benefit amount. Like regular Social Security retirement benefits, age 62 is the earliest you can begin collecting a spousal benefit. But each year you take it early, it's going to be discounted roughly 7% per year. So that if you take it at age 62, you're going to get roughly 75% of that 50% spousal benefit amount. On the opposite end, there are no delayed retirement credits on a spousal benefit. What that means is your spousal benefit will not continue to increase 8% per year after your full retirement age. And so if you're planning on taking a spousal benefit instead of a retirement benefit, you'll never want to wait past your full retirement age to begin collecting it. But at the end of the day, spousal benefit, graded of your retirement benefit or 50% of your spouse's benefit. All right, usually when I get to the slide and I'm doing this presentation in person, I get a couple cheers in the audience. And so, divorce spouse benefits. So if you were married for at least 10 consecutive years, you can collect a greater of your benefit or 50% of your ex-spouse's benefit. Okay, once again, you had to have been married at least 10 years in order to apply for this. Unlike a spousal benefit, where before I said Jane had to begin collecting, as long as your ex-spouse is at least age 62 and you have been divorced for longer than 2 years, you do not have to wait for your ex-spouse to begin collecting. You can just go ahead and start up your spousal benefit off of their record. All the other rules are still the same though as a spousal benefit. Age 62 is the earliest you can begin collecting, but each year you take it early, right? It's going to be discounted, and there's no delayed retirement credits past your full retirement age. A couple tacky things about divorce spouse benefits. I could have been married 3 times, all of which lasted 10 years or more. I could have 3 ex-spouses collecting off my record. I don't know what's happening. It doesn't negatively impact my benefit at all, but I could technically have 3 ex-spouses collecting off my record. Or vice versa, if I wanted to collect off one of their records, I don't get all 3. I just get 50% of whoever benefit I'm eligible for. So whoever has the highest benefit that I'm eligible for at that time. All right, that brings me to survivor benefits. So if you were married for at least 9 months and your spouse passes away, you can collect a greater of your Social Security benefit or 100% of their benefit. So before where I said it was 50, now it's 100, okay? So let's take a look at this example here. Chris is eligible for $2,000 a month and Julie's eligible for $1,200 a month off of her record. Chris passes away and Julie's benefit is going to be replaced by Chris's $2,000 retirement benefit. So she will be able to collect 100% of Chris's benefit amount. You don't get both. You just get the greater of your retirement benefit or 100% of your deceased spouse's benefit. It's also important to note that if you're applying for this strategy, you need to go to Social Security office to let them know. Okay, they're not going to come to you and let you know that you're eligible for this higher benefit amount. You go to them, okay? A couple rules about survivor benefits. Once again, you have to have been married at least 9 months in order to collect a survivor benefit. The earliest you can start a survivor benefit, though, is age 60, not 62. And each year you take it early, though, it's going to be discounted once again. So instead of receiving the full 100%, you'll end up receiving less. Also, if you are married for at least 10 consecutive years and your ex-spouse, you get divorced and your ex-spouse passes away and you don't remarry until after age 60, you can collect the greater of your benefit or 100% of your deceased ex-spouse's benefit amount. Okay, one strategy that we'll often see couples use with survivor benefits is the primary worker who has the higher benefit amount will let theirs grow until age 70, so that way if they pass away, the surviving spouse can collect 100% of that increased benefit amount. So it acts as some additional insurance, essentially. But that's survivor benefits, so the greater of your benefit or 100% of your deceased spouse's benefit. Dependent benefits. So we have a client at Haran who just started collecting his Social Security retirement benefit, and he is about to welcome his 7th child into this world. And so his child will be eligible for 50% of his Social Security benefit amount while he's living, or 75% of his benefit amount if he were to pass away through age 18, as long as they're enrolled in high school. Okay, here we have Chris, Julie, and Johnny now. So typically what we see happen is you might have legally adopted a child. Okay, this would still qualify. So Chris's benefits $2,000 a month, and Julie's benefits $1,200. Now they have a child, Johnny, who's age 15, we'll say. Chris passes away, and Julie's going to apply for her survivor benefit and receive 100% of Chris's benefit amount. But now that Chris passed away, Johnny can also collect 75% of his benefit and get $1,500 a month through age 18. We don't run into this situation too often, but just know that if you are legally taking care of someone who is under the age of 18 and you are collecting Social Security, there might be a strategy there for you. All right, this last strategy is called the restricted application. And I've seen the strategy make the difference of roughly $100,000 over the course of someone's life. So with a restricted application, unfortunately, this is getting phased out of the system. And so you may not be eligible to do this. And unfortunately, most people aren't. But the key, the magic rule here to know if you're eligible for is you had to have been born on or before January 1st of 1954 in order to be eligible for this strategy. Okay. Once again, you must have been born on or before January 1st of 1954 in order to qualify for this restricted application strategy. What a restricted application allows you to do is separate your spousal benefit from your personal retirement benefit. So the way Social Security works now, it's called deemed filing. So if you are eligible for a spousal benefit and your retirement benefit, when you go to apply for your Social Security benefit, you are just going to get the greater of the two. Okay, you don't have the ability to separate them so that they work independently. You're filing for both at the same time. It's called deemed filing. What a restricted application allows you to do is separate your spousal benefit from your retirement benefit so that they work independently. You're essentially telling Social Security, I want to restrict my Social Security application to just my spousal benefit. I don't want to touch my retirement benefit. So let's take a look at this example, and I think hopefully it will make a little bit more sense. Mike and Jane are 66. Mike was born before January 2nd of 1954. Mike is eligible for $2,000 a month off of his record. Jane is eligible for $800 a month off of her record. And so instead of Mike starting his Social Security and Jane collect the spousal benefit off Mike's record, Jane's just going to go ahead and start up her retirement benefit of $800 per month. Mike, who was born before January 2nd of 1954, is going to restrict his Social Security application and begin collecting his spousal benefit and receive $400 per month off of Jane's record. In the meantime, his personal retirement benefit is going to continue to grow 8% per year until he turns age 70. At age 70, he's going to flip from his spousal benefit to his increased retirement benefit, which has grown from $2,000 to $2,640 per month. And now that he's collecting his retirement benefit, Jane is now eligible to collect the spousal benefit, and so she can receive half of Mike's PIA and get $1,000 per month. Essentially what's happening here is Mike is just getting a free spousal benefit from 66 until 70, and his personal retirement benefit is continuing to grow 8% per year. Okay, but that's all a restricted application is. Just know you or your spouse must have been born before January 2nd of 1954 in order to qualify. If you do qualify, just know there's something called a restricted application that you should look into taking advantage of. Don't walk away today feeling like you need to be an expert on any of these strategies. Just know that you have a resource available to you. Should you have any questions, I'm happy to sit down with you and talk about what strategy is best for your situation. I did see a question come in as well. I will be answering all questions at the end of the presentation. The next part we're going to talk about is the windfall elimination provision and government pension offset rules. So this applies to individuals who have a non-covered pension. And bear with me because this is one of the most difficult things to explain when it comes to Social Security rules. And so once again, this section only applies to individuals who have a non-covered pension. So that is a pension that they were contributing to instead of Social Security. So being in Ohio, the two most common ones are the state teachers retirement system and the public employee retirement system. So they're contributing to a separate pension system instead of Social Security. Windfall elimination provision applies to individuals who have both Social Security and a non-covered pension amount. And so if you have a non-covered pension, these rules might negatively impact the amount that you are eligible to collect from Social Security. And you do not find out about this on your statement anywhere. Your statement numbers do not reflect this whatsoever. You find this out when you actually apply for your benefit amount. So once again, windfall elimination provision applies to individuals who have both Social Security and a non-covered pension. And what Social Security will do is dependent upon how many years you contributed to Social Security versus your non-covered pension, that will determine what sort of windfall your Social Security benefit will experience, meaning what sort of reduction you need to subtract from your Social Security benefit amount. And so there's some calculators online on the Social Security website that you can use to figure out what the windfall will be on your personal Social Security benefit. But the easy way of estimating what that windfall will be is turn to page 3 of your Social Security statement and count up how many years you contributed to Social Security. If you contributed for over 30 years, there is no windfall on your record. And so you will receive both your full Social Security benefit and your full pension amount. If you contributed to Social Security for less than 20 years, use this table here and subtract the corresponding amount. So if you contributed less than 20 years, you need to subtract roughly $480 from your Social Security benefit to know what sort of benefit you'll actually walk away with after the windfall has happened. Okay? But the key to remember here is just count up the amount of years you contributed and subtract the corresponding amount from this table, and that's how you know what sort of windfall your Social Security benefit will incur. With windfall elimination provision, you'll still always get something from your Social Security benefit, it just might be reduced. And this is the maximum that they can take away dependent upon the years that you contributed to Social Security. There's also something with Social Security called the government pension offset rule. This applies to individuals who don't have Social Security. They have a non-covered pension, but they want to try and apply for a spousal benefit or a survivor benefit off someone else's record, okay? Unlike windfall, where I said you'll always get something, it'll just be reduced. For government pension offset rules, this could reduce any Social Security benefits you're eligible for to zero. So what the administration is going to do is they're going to take 2/3 of your non-covered pension amount and subtract it from whatever you would have received from Social Security. And if that ends up being zero, then so be it, it's zero. So in this example here, we have Jane, who's a non-covered, who has a non-covered pension of $3,000 per month. Her husband, John, has a Social Security benefit of $2,000 per month. John passes, and Jane's going to try and apply for her survivor benefit and collect John's 100% or $2,000 per month Social Security benefit. Because she has this non-covered pension, Social Security is going to say, hold up, this qualifies under government pension offset rules, so they're going to take 2/3 of her non-covered pension amount. So 2/3 of $3,000 is $2,000, and they're going to subtract it from her survivor benefit of $2,000. So 2,000 minus 2,000 is zero. Unfortunately, she's not going to get anything from Social Security. There are murmurs that they're trying to get rid of this rule, but until then, this is the way that it works. If you are a non-covered worker and have questions about how your Social Security will be impacted by your non-covered pension, once again, feel free to reach out. Happy to help you figure out what that impact will be. So Social Security and taxes. So this is an important part. When you apply for your Social Security and you begin collecting your check, a portion of your Social Security may be subject to income tax. And the amount that is subject to income tax is dependent upon something called provisional income. And so the IRS determines your provisional income as all your income excluding Social Security, plus 1/2 of your Social Security benefit, plus any tax-exempt interest. Okay, I don't know how they come up with these rules. But essentially, just know, if you're married filing jointly and your income is over $44,000 per year, we'll say, up to 85% of your benefit is subject to tax. So what that means is 15% of your Social Security is tax-free. The other 85% you pay tax on, and it's at your ordinary income tax rate. So for most retirees, it's 10 to 12%. There's no state or local tax on Social Security in Ohio, Kentucky, or Indiana. If you live in a state outside of these, double check your state's tax rules. Some do tax a portion of your benefit amount. But the reason I bring this up is when you apply for your Social Security benefit, the administration does not ask if you would like to withhold anything for tax. So make sure when you apply, you tell them that you would like to withhold something for tax, because if not, come next April, more than likely you will owe a tax bill. So you can choose between 7, 10, 12, or 22% federal income tax withholding. So maybe do 10%, and hopefully that will be more than enough to cover you from a tax perspective, okay? But if you can change your tax withholding at any time, it's a simple form that you fill out and you just drop it off at your local office. All right, so you know what strategy you want to use to begin collecting your benefit, and you know how much tax you want to withhold from your benefit amount, and so you're actually ready to apply. And so you have 3 different ways that you can apply for your benefit. But you want to start the process 3 months before you would like to begin collecting your benefit, okay? 3 months before you'd like to begin collecting is the earliest you can start the application process. And you have 3 options. You can either visit your local Social Security office to fill out the application. You can call and schedule a phone appointment. So there's the 1-800 number. We would encourage you to call at 7 a.m. when the phone line's open so that you're not on hold for an hour and a half. Or 3, we help individuals do this all the time. You can file for your benefits online. It takes about 30 minutes to do. The only thing is you cannot file for a survivor benefit this way. You do need to visit your local Social Security office to apply for those. And the day that you apply, okay, so 3 months before is when you'll apply, but the month that you start collecting your Social Security, you do not actually receive your first payment until the following month, okay? Your checks are paid a month in arrears, and the day that your check comes is determined based upon the day of the month that you were born. So if you were born the 1st through the 10th, you will receive your check the 2nd Wednesday of the following month. If you were born the 11th through the 20th, you'll receive your check on the 3rd Wednesday. And if you were born the 21st through the 31st, you will receive your check the 4th Wednesday. So for example, if you turn your full retirement age in April and you want to apply for your benefit to begin in April, what you will do is you will start the application in January. On the application, you will elect you want your benefit to begin in April, and your first check will come the following month in May. But once again, the reason I bring this up is because the checks are paid a month in arrears, you want to make sure you have enough income to get by for that 1 month until you actually receive your first check. All right, something new in Social Security that was introduced a couple years ago is designating a representative payee. So if you have done your diligence with your estate planning and you have set up a legal document called a financial power of attorney, which allows you to make decisions, allows you to elect individuals who can make financial decisions on your behalf should you ever become mentally incapacitated and unable to do so yourself. Social Security does not recognize these legal estate planning documents, okay? So on your Social Security website, there's a portion when you log in and you scroll to the bottom there, there's a section where you can designate up to 3 individuals who can make decisions for you about your benefit on your behalf should you become unable to do so yourself. So I would encourage everyone after today's call to log into your account and name at least 1 individual who can make a decision for you should something happen. You do not want any hiccups when it comes to your Social Security benefit payments. All right, last slide here. Social Security and retirement planning. So I meet with a lot of upcoming and current retirees. And I think the biggest question I get when it comes to retirement planning is, Mike, how much money can I live off of in retirement without running out of money? Right? I think that's most people's biggest concern is how much can they live off of without worrying about running out of money in retirement. So this is the easy way for you to figure out what you can live off of in retirement. What you're going to do is you're going to add up all your investment accounts, okay? IRAs, 401ks, 403bs, add them all up into one big bucket. We'll call it $100,000 for easy math. A conservative retiree investment portfolio should make between 4 to 5% per year. So the whole idea is you make 4 to 5% per year, and you take 4 to 5% per year. So your account kind of stays the same. So if you have $100,000 and you make and take, call it 5% per year from your account, that's $5,000 per year in income that your investments are providing you. You'll take that number, divide it by 12 to get a monthly amount. So we'll call it $440 per month or so. So you have $440 per month from investment income. Then you're going to add your monthly Social Security check to that, and then any monthly pension benefit payment that you might be eligible for as well. And so that's how much income you have coming in every single month. And so maybe take away, call it 12% for taxes. And so when you're planning around retirement, that's the amount that you want to budget around. That's the income that you have coming in. At Haran, once again, I am a financial advisor. I help individuals do this all the time. If you have questions about your Social Security, your financial planning, or your investments, happy to talk to you about that. We do not start to sit down together and figure out what is the best strategy for your situation. But with that being said, I appreciate everyone's time today. I'm going to stick around and answer any questions that might have come in the queue. And in the meantime, I'm going to pass it off to Nate Epp, who once again is our Medicare expert. So thank you everyone for your time today. I really appreciate it.
All right, Mike, excellent job as always. Appreciate it. All great information. I feel like I've heard that presentation so many times, and I feel like I pick something new up every time I hear it. So thank you all for joining. We'll get my screen pulled up here, and we'll jump into the second half of the presentation talking about Medicare. Bear with me here just a moment. Get some of these boxes out of the way. All right, navigating Medicare. Similar to what Mike said before, this is just a ton of information that we're just throwing at you all at once. So we understand this a lot. We don't expect you to, become an expert as soon as this is over and memorize all this stuff. But when this presentation is over, we'll send you a copy of the presentation. This will also be recorded. That we'll send that recording out as well if you ever need to refer back to it. So just know that you have a resource here at Haran. We got myself, and we got a couple other agents as well that are happy to help anyone who needs assistance with this. Unfortunately, it's a difficult topic, and it's difficult to navigate. So that's what we're here to do. So we'll jump into the agenda. Let me see if I can get this out of the way here. we go. All right, we'll do a brief overview of Medicare. We'll talk about some common misconceptions. Then we'll dive into the different parts of Medicare. We have a little roadmap that shows you exactly what your options look like, insurance options once you're on Medicare. Give you a couple comparisons of supplement plans, talk about drug coverage. There's a couple penalties to be aware of in Medicare. And then at the end, we'll talk about HSAs. Health savings accounts. So if you're on an HSA, this is at work, this is an important topic to learn about. And just so you know, before we head off to the next slide, just a little bit about Haran when it comes to Medicare, how we fit into this puzzle. Basically, Haran's considered an independent agent, independent broker. So what that means is that we contract with about 10 different insurance companies. And when folks come to us and they need help figuring all this stuff out, we help shop all the different plans that are available. We take a look at what your needs are, and we try to help you find the plan that best fits your particular needs. And whichever company you end up choosing, when we help you get enrolled, that insurance carrier actually pays us a small commission because we stepped in and we helped you out. We're not allowed charging any fees to you. So there's no cost to get our help. It doesn't impact the cost of your plan or what plans are available to you. You're simply just getting our help at no additional cost. So, and that's true for everybody. So if you have friends or family that are confused and need help with this stuff, we're here to help as well. Okay. All right, let's jump right in to the first slide here. Medicare. It started in 1965, and it is designed for 3 groups of individuals. Okay. The first group of individuals are those who qualify based on their age. So you are eligible to start on Medicare the first of your birth month. So wherever your birthday falls in the month, let's say you're January 15th, you can start Medicare January 1st. Okay. So it always goes back up to the first of your birth month is when you're first eligible. Now, I always have 1 or 2 in the crowd that if your birthday happens to fall on the first of the month, you can actually start a month earlier. So if your birthday happens to be March 1st, you can actually start Medicare February 1st if you wanted to. Okay, but for everyone else, it's the first of your birth month. All right, so you qualify based on your age. Number 2 is you qualify if you are on Social Security disability. And this is actually regardless of your age. So we have some clients in their 40s and 50s on Medicare because they have been on Social Security disability for 24 months. Okay, once you're on disability for 24 months, you are automatically enrolled in Medicare on your 25th month. Okay, number 3, we only see this a handful of times each year, but again, this is any age. Those who are diagnosed with end-stage renal disease, that's permanent kidney failure, and Lou Gehrig's disease as well, ALS. Diagnosis of either of those, regardless of your age, you also qualify for Medicare. Okay, so those are your 3 groups of individuals that are eligible. And Medicare has 4 parts, A, B, C, and D. And it's going to kind of feel like we're going through half the alphabet today, but just know on this particular slide, what you need to know is that these main 4 parts, 2 of these parts are through the government and everything else is through insurance companies. So Part A and Part B, that's your hospital and your medical insurance. Those 2 parts, those are the parts that the government provides, okay? So there's basically 2 big pieces to this puzzle. Government portion, A and B, and then insurance portion, which is Part C, which they also call Medicare Advantage plans, prescription drug plans, and there's another product out there called a Medicare supplement plan, or Medigap is how it's referred to sometimes as well. All right, so got the government portion of Medicare, insurance portion of Medicare, and I'll show you how these work together throughout this presentation. So we'll start with myths of Medicare. Before we jump into those 4 parts, there are some very common misconceptions that I hear all the time. So hopefully this will help clear up some questions that you have. And by the way, same process that we went through with Mike on Social Security. If you have any Medicare questions, throw them in the chat box, and then at the end of the presentation, I'll answer those questions. So if you want to hang on at the end, we're going to answer all your questions, okay? All right, myths of Medicare. Number one, I hear this every day, all day, multiple times a day. This is by far the number one myth I hear all the time. The myth is that you have to sign up for Medicare at 65. Okay, that is true for some people, but it's not true for everybody. Okay, so here's what you need to know. When you sign up for, or excuse me, okay, sorry, I had a chat come through and I read it instead of continuing. So the myth is, here's the myth. The myth is that you have to sign up at 65, which is true for some, but not for everybody. So here's the rule. The rule is if you have health insurance coverage through your employer or a spouse's employer, okay, and as long as that employer has 20 or more employees, then you don't have to sign up for Medicare at 65, okay? So if you're turning 65 and you plan to keep on working and you plan to stay on your health plan at work, there is nothing that you need to do with Medicare at that time, okay? I'm helping people now that are retiring at 68, 69, 70. They have not signed up for Medicare at all. They've been on their employer plan and they're perfectly fine, okay? There's no penalties with delaying Medicare as long as you have that coverage through the employer, okay? So now option number two is you can sign up for Medicare at 65, okay? So turning 65 counts as a qualifying event where you can come off of your employer plan and go on to Medicare. So you do have that option if you wanted to. Now, whether that's a good option for you or not, that depends on several things, okay? So that depends on how much are you paying for your plan at work? What are your benefits like? You know, do you have great benefits or not so great? Do you have a spouse, a younger spouse? So if you do, then you probably want to hang on to your employer plan until your spouse reaches 65. So many factors in play there on whether you should go to Medicare or not. I help people with that all the time. You know, they want to compare what they're paying currently through work, what their coverage is like, and then I'll show them what Medicare would look like, and we kind of just decide which one makes the most sense. Okay. Now, I hear this all the time as well. A lot of people say, well, someone told me that I need to register for Medicare. There's really no such thing as registering for Medicare. So I don't know where that's coming from, but there's no registration that you have to do if you have coverage through the employer. Now, what I do hear a lot too is, well, you know, I was told that I should at least sign up for Part A of Medicare. Okay, that is optional. Okay, so signing up for Part A, there's no cost. There's no cost to Part A of Medicare at all. And it will act as a secondary insurance plan to your employer plan if you have any inpatient hospital expenses. Okay, so Medicare Part A and your employer plan will coordinate together to help lower any hospital bills that you might have. Okay, so if you're on an employer plan, you hit age 65, you can consider signing up for Part A or not. There's only one reason that you would not sign up for Part A of Medicare, and that is the second myth. Okay, so that leads us into the second one here, where the myth is that you cannot have a health savings account after you turn age 65. Okay, so if you have an employer plan right now, if it's a health savings account plan, and you plan to keep on working, and you want to keep putting money in that HSA, then you should not sign up for Part A when you hit age 65. Medicare says that as soon as you sign up for Part A of Medicare, you can no longer put any more money into your HSA, and your employer can't put money into that HSA either. You can still have the health plan if you want, okay, but you can't contribute any more money once you're enrolled into Medicare. So, but if you're not on an HSA, let's say you have just a traditional type PPO plan that has copays for doctors and medications, then you're fine. Go ahead and get Part A. There's no downside to getting it. But again, if you're on an HSA, if putting money in that account is important to you, don't sign up for any part of Medicare at 65. That'll allow you to keep on contributing after turning age 65. okay? All right, the third one on the list here, a lot of people I talk to believe that you just automatically get Medicare when you hit age 65. And that actually is true for some individuals, not for everybody. But if you happen to start collecting Social Security prior to age 65, so if you start if you start collecting Social Security at age 62, 63, 64, you will be automatically enrolled in Medicare on your 65th birthday. Okay, so keep that in mind. If you're on an employer plan, if it's an HSA, if you happen to be collecting Social Security, you're going to be automatically enrolled in Part A on your birth month, which means you have to stop those contributions when you turn 65 if you're collecting Social Security. Okay, but if you're not collecting Social Security, when you hit age 65, nothing happens. Okay, so you're not going to be automatically enrolled. Nothing happens with Medicare unless you actually filled out the application to get it. Okay, so it doesn't happen automatic for everybody. All right. So those are probably the most common questions I hear. So again, throw any questions in the chat box if I didn't clarify anything, or if you need to ask an additional question, we'll follow up at the end. All right. All right. So moving on from the myths, we'll jump into the 4 parts of Medicare. All right. We'll start with Part A. So this again, there are 2 parts that the government provides. This is one of those, Part A. There's no cost to Part A for like 99% of the population. They don't charge a monthly payment. The other 1%, they do charge a monthly payment if you have not worked at least 10 years of your life paying Medicare taxes. So as long as you or your spouse, you can get it from your spouse as well, as long as either one of you have paid Medicare taxes for at least 10 years, you're fine. No charge to Part A. So what does Part A cover? That is all of your inpatient medical expenses. So that's if you get admitted into the hospital, skilled nursing facility, hospice, that rolls up under Part A. Okay. Now, another big misconception I hear with Medicare is that Medicare covers, people assume that Medicare just covers all of your medical expenses, and it does not. Okay. So here's how Part A works if you had it just by itself. Okay. So if you had Part A just by itself, nothing else, I'm going to go over that first bullet point there that says how these services are covered. So if you get admitted into the hospital, there's a deductible, nice, easy, round number of $1,484. So that is what your responsibility is, okay? You're responsible for that deductible. Medicare pays the rest. Now, when you think of a hospital bill, only paying $1,484 is actually a pretty good deal. But that deductible is not like the deductible that you're used to. That's like a once a year deductible, calendar year deductible. It's not how this works. This deductible is what they call a benefit period, and it resets every 60 days. So if you get admitted in the hospital, you owe $1,484. Medicare pays the rest. If 60 days go by, and then you happen to go in the hospital again, you will owe another $1,484. So if you have a rough year and if you have multiple trips into the hospital, there's a chance that you might have to owe that deductible multiple times. Okay, so we really stress during these presentations that while Medicare is there for you, it's basically just considered a base coverage. Okay, you don't want to have it by itself. That's not our recommendation. You want to have something in addition to Medicare to help pick up some of these expenses, which we'll get into here shortly. Okay, Medicare Part B. All right, so as you are planning retirement or you're planning on transitioning over to Medicare and you're trying to figure out how much is all this going to cost me, okay, and you're trying to put together a monthly budget, this is the first monthly payment that you're going to write down. Okay, Part B has a monthly payment of $148.50. Okay, that's per month, per person. Keep in mind, I'm not going to go into great detail on this, but keep in mind that they do charge a higher monthly payment based on your income. So the year that you transition to Medicare, so let's say you transition to Medicare in 2021, this year, they pull your tax return from 2 years ago. Okay, so people that are transitioning to Medicare this year in 2021, they're pulling their 2019 tax return and they're looking at their income from that year. As a single person, it's right around 86,000. or excuse me, 87,000. And then if you're married, joint income is like 176,000. If you're over those amounts as either an individual or married, then you could pay more than 148. So something to think about and to look into as you're planning this transition. Okay, but for today's purposes, we're just going to use the 148.50 a month. Okay, so remember back on Part A, that Part A that we just went over, that's all of your hospital expenses. Part B is all of your outpatient related medical expenses. There's a lot that rolled up under Part B. That's all of your primary care doctors, specialist visits, any outpatient surgeries or outpatient lab work, chemotherapy, medical equipment, ambulance. I can go on for a while about all the things that roll up under Part B, basically anything outside of a hospital setting. So how are these services covered? A little bit different than Part A. So all of your outpatient related expenses, you have a very small deductible, $203 deductible. That actually is a calendar year deductible. That's only a one-time deductible, $203. Once you cover the first $200 of your medical expenses, Medicare starts picking up 80% of those expenses. You cover 20%. Now, 80% is a pretty good chunk that Medicare is covering, which is great. The issue, though, is the 20% that you are responsible for, there isn't a cap, and there is no limit to what you are responsible for. So if you have a rough year and you start thinking about chemotherapy and ambulance and medical equipment and specialist visits and lab work and outpatient surgery, you're paying 20% of all of those bills up to an unlimited amount. So again, we highly recommend that you don't have Medicare just by itself. That's the purpose of having an insurance plan in addition to Medicare to help cover some of these expenses, or at least put a cap to these expenses, so you're not stuck on forever paying 20%. So we're going to get into those insurance options here now. Okay, Medicare roadmap. So this roadmap, this is what we use anytime I have like a one-on-one session with someone and we're trying to just understand, once you're on Medicare, then what are your options at that point? What are my insurance plans that are available to me? And what do I need to know about them? So this roadmap lays all that out for you. So it starts at the top right there, original Medicare. So as you are planning this transition to Medicare, that is step number one in this whole process, is applying for original Medicare, Part A and Part B. You have to do that first, and you're allowed to do that once you're within 90 days of when you need it to start. Okay? So I'm talking to some folks right now that are retiring in June, and they need to start Medicare July 1st. So when we take that back 90 days, that's April 1st. So their timeline is that first week or two in April. That's when they're going to fill out their application for Medicare A and B. Okay? So whatever your timeline is, whatever you need Medicare to start, take it back 90 days, and that's the earliest that you can start that process. You want to apply as soon as you can, because it usually takes about 2 to 3 weeks. I've seen it take a month and a half sometimes for Medicare to process your application, and you can't do any of these insurance plans until you get that Medicare approval first. Okay, so that's always your step number one, apply for Medicare. Now, once you apply for Medicare, they're going to send you a letter that says, okay, congratulations, you're starting on Medicare. Here's your Medicare number. As soon as you get that Medicare number, now you can take the next step, which is picking out one of these options. Okay, so you have the option on the left side of your screen to go with a Medicare Advantage plan. They refer to that as Part C. We'll call it Medicare Advantage today. Or Medigap plan or Medicare Supplement plan. Okay, you got the option to do Advantage or Supplement, one or the other. All right, so I'm going to walk you through kind of the pros and cons and some of the costs associated with each option. All right, so we'll start with Medicare Advantage. What's really attractive about an Advantage plan are a couple things. Okay, the first thing is the monthly payment. The monthly payments on these Advantage plans, most of them are actually $0 per month. Okay, so I don't know if you remember back during the holidays in November, December, there's, every commercial on TV is, hey, we're, call us today with $0 per month, and we have dental and vision, and That's what they're trying to sell you is one of these Advantage plans. Okay, $0 per month. What you do pay for, though, are your medical expenses when they occur. Okay, so when you go to the doctor, there's a copay. Primary care is usually a low copay, like $5 or $10. If you need to see a specialist, that's usually $40. If you go to the emergency room, it's a $90 copay. Day in the hospital is usually like a $350 copay. Basically, you're paying some type of copay amount or percentage for all of your medical expenses. And the plan that you're on right now, these Advantage plans have what they call an out-of-pocket maximum. Okay, there's a limit that says that if you end up spending so much money out of your pocket in copays, once you reach that limit, then you're covered 100% the rest of the year. Okay, those limits on these Advantage plans are usually $4,000 to $5,000, somewhere in that range. So you keep paying copays for all of your expenses, and if you end up spending $4,000 to $5,000 out of your pocket in copays, then you're covered. Then you're covered 100% the rest of the year. So low premium, but higher out of pocket in medical expenses. All right. So the drug coverage of Medicare, they call that Part D. Part D of Medicare, that's your medications. It's included in those Advantage plans at no additional cost. Okay. So that's included. And they also like to throw in a little bit of dental coverage and vision coverage in that Advantage plan as well. The last thing you need to know about an Advantage plan is that they have networks of doctors and hospitals. Okay, so when you're signing up for an Advantage plan, you're signing up for a particular insurance company, like Anthem or Humana or United Healthcare or whoever, whatever insurance company that seems to be the best fit for you. Whichever one you pick, you have to make sure that you're staying in that insurance company's network. So that's part of my job is, I'll ask you for any doctors or hospitals that are important to you. There are about 45 different Advantage plans that you can choose from, and it's important that whichever one you pick, obviously we want to make sure that your providers are in the network for that particular plan. Okay, so I help you figure that out. All right, so that's basically a crash course in Advantage plans. And now on the other side here, we have Medigap or Medicare Supplement. So I'll walk you through the pros and cons of this. And it's basically an exact opposite of an Advantage. Okay, so the concept is that you pay a higher monthly payment on a Medigap plan in exchange for a lot lower out-of-pocket. All right, so higher premium. So what are we talking about here? So under Medigap, there are several options for you to choose from, but the most commonly purchased supplement plan today is called Plan G. Plan G, the only medical expense you are responsible for is that small Part B deductible that we just talked about, that $203 deductible under Part B. You cover that for the rest of the year. After that, it covers all of your medical expenses under A and B. So that means $203 deductible. That is your out-of-pocket max for the whole year. It covers the rest of your hospital, doctor, all medical expenses covered after that deductible. Okay. Now that's going to come with a cost. So the price of supplement plans, they're based on age and gender and where you live. For someone age 65, you're looking somewhere between $105 to $125 a month, somewhere in that range. So that would be a much higher monthly payment than zero, obviously, like the Advantage. But again, the trade-off is a lot less out of your pocket in medical expenses. All right. Now, the drug coverage of Medicare. So remember, on the Advantage, it's included. In the supplement plans, it is not. So that's why you have this plus sign, and then there's a separate drug plan over there. So what you're doing is you're basically buying two separate plans. You're buying a Medigap or a supplement plan for your medical benefits, and then a drug plan for prescriptions. It says there the national average cost is $33. It's really paying about $15 a month is the average that I see, 15 to 20 per month for a drug plan. So you have two different monthly payments if you go this path. Okay. Now, remember back on Advantage that it has networks of providers that you have to stay in. Medicare Supplement you can go to any doctor in the country that accepts Medicare. So you have a nationwide network. You can go anywhere you want. So if you have plans to travel extensively after retirement, or if you have family that's in another state that you're going to see often, you don't have to worry about if something happens to you outside of your state when you're on a supplement plan. So that gives you the most freedom when it comes to networks of providers. Got to be careful on an advantage. There's HMO plans that you have to stay in network. There are PPO plans that do give you a broader network, but you got to pay attention to the networks on advantage, not so much on supplement. Okay. So at the bottom of the supplement column, there's a little bullet point that says it can be guaranteed issue. So there's a very common question I get after I go over this slide, which is, can't I just switch from one plan to the other? Can I do that? Can I start with an advantage and switch over to a supplement, or vice versa? So the answer to that is maybe. Okay, it depends. So there's a catch to all this stuff. All right. So this is a very important rule that you need to know. Okay, so when you first get enrolled into Medicare Part B, okay, they don't go by your start date on A. They go by the start date that you are enrolled into B. You have a 6-month window from that date where you can enroll into any Medigap or supplement plan that you want without answering any health questions. It's a guaranteed enrollment. Okay, that only lasts 6 months. So let's say for example, you take the Advantage plan first, and then a year or two goes by, and then you decide, maybe I want to switch over to the supplement plan. You are allowed to do that during the open enrollment period, which is October 15th to December 7th. You can request to switch from Advantage to supplement. However, it's no longer guaranteed. So they're going to ask you health questions, such as, have you had a heart attack or stroke or cancer? Have you been in the hospital recently? Do you need to have surgery? And based on your health history, they will decide whether they will allow you to switch or not. Okay, so if you take an Advantage plan first, and then something, major diagnosis happens, you can't just switch over to a supplement at that point. You got to stay on your Advantage plan. Okay, so that's an important distinction when you're trying to figure out which route to take. Is that, you got to keep that in your mind, that the best time to get a supplement plan is right when you turn 60, or right when you get on Part B of Medicare. Okay. I have a lot of clients on Advantage as well, and they're perfectly happy with it. So it's not my job to steer you one way or the other. I don't care which route you take, but you just have to be aware of what you're getting into and what the rules are of switching later, and then how your plan works. That's the most important part of today, is to make sure you have that understanding. Okay. So those are basically what it all boils down to, these two options: Advantage, supplement. Okay. All right, a couple more slides here, and we'll be all finished. So this is just a quick, this is a really busy grid. We're not going to go over this, but on the supplement plans, there's a number of them to choose from. I highlighted here Plan G and Plan N. Those are really your top two options to consider. Off to the right, very far right, there's Plan F. That's been basically the Cadillac plan for the last 10+ years, and Medicare's phasing it out. So anybody who's turning 65 from here on out, you don't have Plan F. So Plan G really is your best option at the moment. Okay. All right. So we'll move on to the next. Okay. Prescription drug coverage in Medicare. Hang with me here. This is by far the most complicated part of Medicare, in my opinion. So if you can make it through this slide, then we're pretty much home free after this. All right. So there's a term called the donut hole. I'm not sure if you've heard that term or not, but it's been around since about 2006-ish. And it basically refers to a certain part of prescription coverage. So basically in the Medicare world, when it comes to prescription coverage, you have 4 stages of prescription drug coverage. Okay, stage 1 at the top, that is your deductible stage. Okay, for 2021, Medicare says that the standard deductible is $445. Now, these insurance companies that sell these advantage plans and drug plans, they have a lot of leeway here, whether they are, they can choose to apply the deductible or not. So you might not even have a deductible, but if you do, it can't be any higher than the 445. So once you get through that deductible, then you're going to move into the second stage called your initial coverage period. So all that happens in this stage is that when you go pick up your meds at the pharmacy, you're paying a copay for your drugs. So let's say, for example, you go to the pharmacy and you pick up your meds and they tell you that this one costs $1 copay, this one's a $10 copay. So you pay your copays, and then what happens is that at the end of the month, you get a letter in the mail from your insurance company that says, here's a summary of the medications that you filled last month. Okay, you bought this one that was, you paid $1 for it, and then it shows you next to it, says here's how much your insurance company paid for it. You paid $1, they paid $5. That medication that you paid a $10 copay for, the insurance paid $30 for that. And what they're doing is they're adding together what you're spending and what the insurance company is spending to come up with a grand total of prescription expenses. And what they're doing is they're keeping track, a running tally of how much you and the insurance company are spending throughout the year. Okay? If the total combined costs, drug costs, reach $4,130, you are now moving out of that initial coverage stage, and now you're moving into stage 3, which is the coverage gap stage, aka donut hole. So once your costs reach $4,130, now you don't have copays for prescriptions anymore. Okay, copays are gone. Now you're paying a percentage of your medications. Now you're going to pay 25% for all brand and generic medications. Typically, your costs, what you pay, go up. Usually, this percentage is going to be higher than what your copay is. So, donut holes had a pretty bad reputation over the years because your costs will increase usually once you hit that gap. So now you're at the 4130. Now you're paying 25%. Insurance is picking up 75%. So what they're doing is that 75% that's left over for brand name drugs, they're taking 70% of that and they're adding that in towards this new maximum. So that there's a limit of $65.50 for the year. Okay. And again, I know that's a big number, $65.50, but the majority of that cost is made up of from the insurance company, not out of your pocket. Okay, out of that $65.50, your portion might be $1,500, $2,000 of that. Okay, but if your total prescription cost for the year now hits $65.50, now you're out of the donut hole, and now you've hit the final stage 4, and now you're not going to pay any more than 5% of your medication. Now your costs are going to go way down. Pretty simple, right? I can't see anybody on the call, but I can pretty much guarantee 80% of you are just shaking your head like, what? Who comes up with this stuff? This is just crazy, right? So I know this is terribly confusing, but just know that your experience in this prescription drug world and Medicare, everybody's situation is different. It all depends on how many medications you're on, how expensive they are. Everybody is different, so that's part of my job as well. Is that as we go through this process, I'll ask you to send me a list of any medications that are important to you. I do the research and I help you figure out okay, here's the plan that best covers your particular medication, and I can show you exactly if you're going to hit the donut hole. Most people don't, but if you do, what month is that going to happen? What are your costs going to look like if you hit that donut hole? When are you going to get out of it? Are you going to get out of it? So I can basically show you exactly what your year is going to look like based on your list of medications. So so again, $65.50, that's made up of what you're spending and what the insurance company is spending as well. Okay. All right, moving on. Penalties. All right, we only got about 11 more minutes, and that should give us plenty of time to finish up the last couple slides here. All right, 2 penalties in Medicare you need to be aware of. Part B penalty. We already talked about Part B at the beginning, and Part B is basically as long as you have coverage through your employer or your spouse's employer, and as long as that company has 20 or more employees, no need to sign up for Part B. You can delay enrolling into B, with no penalty. Okay. Once your employer plan actually ends, they actually give you a whole 8 months after that where you can sign up for Part B and not get hit with a penalty. Our preference is that you start this process way before your coverage even ends. That way you don't be left without coverage, but technically they give you an 8-month window after your coverage ends without a Medicare penalty on Part B. Now, Part D penalty. Part D penalty goes a step further and basically says that, even though you have coverage through your employer, that coverage that you have, it has to meet Medicare standards when it comes to prescription drug coverage. Okay, it's got to be good enough according to Medicare. And I don't know what the formula is to, dictate whether one is not good enough or good enough, but the term that they use is called creditable. Okay, so your employer every year during the employer open enrollment period, they should be sending you a letter. No one ever reads it, but the letter, in that letter, it says whether your plan is considered creditable or not creditable. Okay, if it's considered creditable coverage, then you're fine. You don't have to worry about a Part D penalty. Okay, but if it's considered a non-creditable health plan, then what that means is that if you end up staying on that employer plan, you won't be hit with the Part B penalty, but they will hit you with the Part D penalty, even though you're remaining on that employer plan. Now, the penalty isn't much, but it's a penalty that stays with you for the rest of your life. So you need to find out, if you don't know, then you need to find out from your employer whether your coverage is considered creditable or not. Most companies are. We don't see this very often, so I don't want to act like this is rampant. This is pretty rare, but it does happen. So just be aware of that. So I'm not going to go through all the calculations here, but basically, if you find out that your plan is non-creditable and you want to learn more about how do you avoid paying that penalty, give me a call and let me know, and I'll walk you through all the strategies and your options to help avoid paying that penalty. Okay. So we'll skip through this slide and we'll talk about the last 2 slides here, HSAs. Okay, keep in mind, this is what we talked about at the beginning, that if you enroll in Medicare, you can no longer put money into that HSA, and neither can your employer. And keep in mind that drawing Social Security triggers an automatic enrollment into Medicare. So, Mike just talked about Social Security, and, there's different strategies on when to start collecting Social Security. But just keep in mind, if you hit your full retirement age and you're going to keep working and collect Social Security at the same time, you got to keep in mind that if you draw Social Security, you will be automatically enrolled in Medicare, which means you got to stop your HSA contributions. Why this is all connected like that, I can't tell you why, but it is. So just keep that in mind as you're planning that. Also keep in mind too, all these rules I've been telling you about, if you were to sign up for Medicare, you can't put money in your HSA, that only applies to the employee, okay? That does not apply to a spouse on the plan. So if you have a spouse, and let's say the spouse signs up for Social Security, they get enrolled into Part A, you're on an HSA plan, no impact at all, okay? So they don't care about your spouse on their Medicare status. Only you as the employee, that's who they care about. Okay, so no worries on the spouse status. Now, let's say you have money in that HSA, and after age 65, you want to use that money for something other than a medical expense. So if you want to go buy, I don't know, a new boat, or go, use it to go on vacation or something, you can do that, and there's no more penalty. However, you still have to pay taxes on that money. It's not tax sheltered anymore once you take it out for a non-medical reason. But they don't hit you with that 20% penalty after age 65. All right. Okay, last slide. So let's say you retire and you have a money sitting in this HSA still. You're on Medicare now. You can't put any more money into that account, but you can use the money that's in there now to pay for your Medicare premium. Okay, so that Medicare Part B premium, that was $148 a month. You can use your HSA money for that. your drug plan, you can use your HSA money for that. Also, any copays or deductibles. I mentioned that Medicare Advantage plans are $0 per month. Most of them are. There are some that charge a monthly payment. You can use your HSA money for that. The only thing in Medicare that you can't use your HSA money for are your Medigap or Medicare supplement premiums. I don't know why, but that's just the one thing that's not included. All right. Last weird rule with Medicare, and then we're all done. And then I'll hit up the chat box here. So last rule with Medicare you need to know is that this doesn't apply to you when you're turning 65. This applies to you if you delay Medicare until a later age. Let's say you delay all of it until you're 68 and you retire. When you go to sign up for Medicare, you're going to tell them when you need Medicare to start. And what they're going to do is they're going to start Part B when you want it to start. But Part A of Medicare, they retroactively start it back 6 months. This is another one of those head shaker rules that just kind of don't make sense. But so here's what you need to know about that. Now, remember, the rule is because they take Part A and they retroactively start it back 6 months, remember the rule is that you can't put money in your HSA when you're enrolled in Medicare. So because they take that back 6 months, that means you have to stop contributing 6 months before you apply for Medicare. Yeah. So notify your HR team, say, hey, I'm planning on enrolling in Medicare as of this date. I need to stop HSA contributions as of this date. That's how you plan ahead for this stuff. Now, not everybody has the luxury of planning 6 months in advance of retirement. I've talked to plenty of people that have said, I need Medicare to start in 2 months. We're getting downsized, or I need to retire, can't take it anymore, or something like that. So what happens? So basically, any money that's been contributed in that 6 month window, once you're on Part A now, any money that's been contributed is simply not tax deductible anymore. So you have to pay taxes on it. So it's not the end of the world, but it's just something to keep in mind. And if you can get ahead of it, it'll save you a little bit of money at tax time, not having to pay taxes on that money. So I know all this is terribly confusing, but again, that's what we're here to do. We are your resource to help you make this transition. So here are a list of resources. There's my information at the top. Another gal in my office, Heather Blue, is fantastic at what she does. We both handle Medicare. We also both handle individual health plans for people who are not yet 65, but they need to buy their own individual health plan. Her and I handle that as well. And then you'll see there's a link at the bottom, Medicare analysis form. There's a little form on our website where you can fill out your information with your doctor and your prescription coverage, and we can help you research the different Medicare options available and show you exactly what that would look like for you. So we are all finished with the presentation. So you are all free to go. We thank you so much for joining. I'm going to hang on here and answer these questions in the chat. You're welcome to hang on and throw those questions in there. If you have no questions, you're free to leave. And thanks again. We'll follow up with an email with both presentations as well as a recording that you can watch later. All right. Thank you so much. And you all have a great day. All right, chat box. Let's see what we got here. Okay.
And hey, Nate, just to let you know, I sent you an email with some questions that came directly to me as well. So if you, and as well,
okay.
Sent one to Michael too. So.
Okay, great. Let's see. Let's see. There was a question about, if you have TRICARE. So yeah, there's military, there's the VA, there's TRICARE. Those are that would be a question for TRICARE that I would contact them to see what those requirements are. I know when you hit age 65 that TRICARE has a retiree health plan, and you have to be enrolled in both Medicare A and B in order to stay with their retiree health plan. But I'm not an expert on TRICARE, so I would give them a call for any questions about covering covering a spouse and dependents. Sorry, Brian, I'm not expert on the TRICARE specifics. Let's see, are there penalties if one is enrolled in A and still receives HSA? So yeah, we talked a little bit about that, Julie. So the penalties, so if you contribute into your HSA and you're also enrolled into Part A, you not only have to pay the tax, your normal ordinary income tax on that, but IRS technically says that that's considered an excess contribution, and there's a 6% what they call an excise tax on that money as well. Let's see. What happens to those employees that don't tell us they enrolled in Part A and we have still been giving them money into their HSA? Yeah, I mean, again, technically, that money, according to the IRS, is not considered tax deductible anymore. So I would encourage any HR folks on the call. I would encourage them to somehow capture that during open enrollment. I'm not an employee benefits specialist or an expert, so I'm not sure exactly how that would work on the on the employer side, but maybe ask the question, or maybe just a blanket statement to all the employees during open enrollment, just to say, hey, if you're on Part A, you need to let us know so we can make sure we're compliant with IRS requirements. So, but basically any money that's in there, they would have to pay taxes on it plus the penalty. But technically those contributions should not be made to that account. How does Medicare coordinate with one's work insurance? Which one is considered first payer? So if you are on an employer plan that has 20 or more employees, that employer plan is considered primary, Medicare is secondary. So that claim first gets sent to your insurance company then sends it to Medicare, and then they will coordinate together to help lower that bill. So if it's a hospital bill, then you'll have that $1,400 deductible. If you happen to be on Part B and employer coverage, that doesn't happen often, but they'll cover 80% of what's left over. But you have to cover both deductibles. No, let's say you're on like a high deductible, like a 5,000 deductible health plan, and you have a large medical bill and you're responsible for the first $5,000. Medicare Part A would kick in and say, instead of covering the first 5,000, you only have to pay 1,400 instead of the full 5,000. So could be beneficial if you have a high deductible and a large medical bill. Yes, thank you for telling me not to hit my table. I had a bad habit of doing that, and it probably shakes the screen. So appreciate the comment there very much. Okay. In the donut hole is the amount. The difference between. Yeah, the donut hole is when you're in between the 41. Once you hit 4130, the donut hole is between the 6550 and the 4130. So you're paying 25%, and insurance is picking up a portion until those total costs hit 6550. So yeah, donut hole is in between those two amounts. Okay. Is there a grace period, 1 year, 2 years, et cetera, to be able to jump from the Advantage plan to the supplement plan with no medical questions? There actually is, but it depends on which company you have. So some companies internally, they do have guidelines that say if you start with an Advantage plan and you're within 1 year still within your first year of being on an Advantage plan, you can switch to a supplement without having to answer medical questions. So that's an insurance company specific guideline. So yeah, that's something to keep in mind as well. They usually give you a year, not 2 years. It's the most I've seen is 1 year. So that is an insurance company rule that's up to them. So I think that's it for the questions in the chat. I'll check my email and let's see what we got there. Let's see. I have another one about TRICARE. You know, if you're on TRICARE again, I know once you hit 65, in order to continue that TRICARE coverage, you have to be enrolled in Medicare. But I would defer any TRICARE questions to TRICARE. Let's see. There's another question here. Can I get Medicare any earlier than 65 if my husband was on disability and he passed? Unfortunately, Medicare, not the same as Social Security. So Medicare is based on your particular situation. You would only get Medicare earlier than 65 if you happen to be on disability. You don't get it because a spouse is on disability. So it's just whether you're on disability or not. Let's see. I want to retire at 65, collect Social Security benefits, and take Medicare. However, I'm a retired military and also have TRICARE for life. My spouse is a year younger than me, and she will have TRICARE Select when she turns 65. So, again, TRICARE, I know once you hit 65, you got to be enrolled in A and B to have their retiree plan. But yeah, I would give them a call and just confirm those questions. There's a question about, Medicare, does this apply to your spouse as well? So yeah, your spouse, same rules for a spouse. They don't have to sign up at 65 as long as they're on your health plan. Again, that's optional. The spouse can come off if they want to. So I can help you decide whether to do that or not. All right, we're getting towards the end of these questions. Yeah, can you switch from supplement to Advantage? Yep, we talked about that. Or no, we didn't talk about that. Yes, supplement to Advantage, you can do that, absolutely. They don't care about that switch. You can make that switch. That's not a problem. It's going from Advantage to supplement. That's when you have to answer the health questions. All right, what if you go on Medicare and your company has less than 20 employees or it drops below? So if the company has less than 20 employees, then yes, you do have to sign up for Medicare. Otherwise, there will be a penalty if you don't sign up at 65. So less than 20 employees, got to sign up. Okay. All right. Does the 6550 include the 4130? So that talks about the prescription drug coverage. Yes. Yeah, the 6550 includes the 4130. All right. Do you work with the medical benefits that federal employees have and what to do with Medicare? Let's see. Federal employees. So yeah, if you have a separate retiree health plan through any program, so it's a federal program, or let's say it's FTRS or FERS or Kentucky Retirement Systems, KRS, those are private and public retiree plans, then they have their own Medicare insurance plans. You still have to enroll into both Medicare A and B in order to take advantage of any of those retiree programs. So that would be, you'd want to compare that to what we just went over today and figure out, is that retiree plan better than what you can get on your own? And I can help you with that. So that's it for the questions. We went 10 minutes over here, so I appreciate anybody hanging on. If there's any other questions I didn't answer, you are welcome to send me an email, give me a call. Happy to help you if you need it. Otherwise, you all have a great day, and thank you very much.